in my long career as a nurse and then as an administrator, I have never seen a hospital, a tertiary care pediatric hospital having to open an extra critical care unit for pediatric patients like has happened recently. My other concern is the fact that hospitals are sending 14 and 15-year-olds to adult critical care units. So those are signs that all is not the usual in pediatrics, for sure.
That's Sue LeBeau, President and CEO of the Margaret Koshner Memorial Hospital in Red Lake. She was speaking yesterday during a Northwest Ontario Healthcare Leaders Media Conference. Hospitals across Ontario are seeing a surge in respiratory illnesses, particularly among children. Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, urging people to start wearing masks again. He says that surge is straining staff resources and leading to cancelled surgeries and other procedures. He's stopped short of calling for a mask mandate, but many are calling for it, particularly in schools. For more on the current situation, we're joined by Dr. Janet DeMille, Thunder Bay's Medical Officer of Health. Good morning.
Good morning.
So what are your thoughts on masking based on what you're seeing in our area?
I echo the comments that Dr. Moore made yesterday, really strongly recommending that people wear masks in indoor public spaces, in indoor spaces, actually. This is overall the picture that has really emerged, and you just, the Red Lake quote that you just provided as an example, but across the province, the impact that all of these viruses, particularly RSV and influenza right now, are having on the healthcare system are significant. What we're seeing here is sort of echoing that. We are seeing that increase in emergency department visits. We've seen our flu cases go up. We had an early start to the flu season. And certainly seeing just anecdotally the pressures with the healthcare and on the system right now. And the numbers are really still going up. So, and the concern, hearing from the Chief Medical Officer of Health yesterday, but seeing some of the data provincially, hearing from Dr. Chris Simpson, who's with Ontario Health North and very much, Ontario Health, and very much understands the pressures across the province. I think that this is a fairly concerning situation.
Well, that being said, do you think strongly urging people to start masking goes far enough?
That is a good question. I think the issue of masking is a difficult one because it has been, politicized. I think a lot of people, and also heard this on the news, right? Different premiers saying that about not wanting to go that particular direction and mandating masking. I think mandating, if it were to be mandated, it would have the biggest effect on sort of limiting or reducing the spread of all of these viruses that we're seeing. And at the same time, it does impose, that on individuals, although I think that that's a fairly minimal kind of imposition, wearing masks indoors.
Now, when we spoke last, you did point out that masking could help with that early flu season we were seeing. Do you think this call from the province should have come earlier? Well, that's a good question. It's really, it would have been helpful had if it come earlier, even last week, because even a week can make a difference. Certainly there was encouragement or some recommendations, especially for those at higher risk, which is, a reasonable first step. But it really depends on the overall modeling and the data and, wanting to be data informed as we navigate these difficult decisions. And then, it is challenging. How do you think our community will respond to this recommendation, this urging?
We've certainly seen when things have, we've been recommending things in the past that there are
people that do respond and take heed, and they do understand, and that has linked to masking or has linked to sort of vaccines, for example. So I really am hoping that people will respond and, think of, the children. This is really impacting, on pediatrics, children under the age of 4, including, young children and babies. So, many people interact with families, or they've had kids, or have babies, and I think that's really, that might motivate a lot of people as well. And of course, it's not just that as a risk group. We are really going to start to see increases in influenza in adults, including older adults and those with underlying conditions. And so masking is going to help offset some of that as well.
Now, we've heard from at least one parent group on our show even saying schools should return to masking in light of illnesses among children. Is that something you might consider ordering?
So that is not something I can necessarily order with the tools that I have. That sort of changed with the changes in the regulations and such. So that would be really like a provincial decision or at the board level. And I'm not hearing that is something that is being planned to be mandated at this time.
All right, but that's not under your control anymore.
No.
All right. I appreciate you joining us this morning. Anything else you want to get across before I let you go?
Just the usual reminder and promotion of vaccines, what's impacting the kids as well. And as I mentioned, we'll go to the older age group shortly, is flu vaccine for sure. And children under the age of 4 are considered high risk for influenza, and that's what we're seeing, and it's complicating the picture with RSV right now as well. And certainly encouraging people, bringing their children in, as well as family members, household members. If you're interacting with children under the age of 4, with babies, especially those under the age of 6 months who aren't able to get immunized, to please come as soon as possible to get your flu vaccine.
Thank you so much.
Thank you.
That was Dr. Janet DeMille, Thunder Bay's Medical Officer of Health.